You're too late. You're gonna have to catch the next bus there.
Complex regional pain syndrome is an uncommon form of chronic pain that usually affects an arm or a leg. CRPS typically develops after an injury, surgery, stroke, or heart attack, but the pain is out of proportion to the severity of the initial injury. The cause may be due to a dysfunctional interaction between your central and peripheral nervous systems and inappropriate inflammatory responses. However, it is not exactly understood. Treatment is most effective early to reduce the risk of atrophy and contractures. There are two types of CRPS. CRPS1, also known as reflex sympathetic dystrophy syndrome. This type occurs after an illness or injury that didn't directly damage the nerves in your affected limb. About 90% of people with complex regional pain syndrome have type 1. CRPS2 was once referred to as causalgia. This type follows a distinct nerve injury.
Changes in the color of skin, hair, nail changes, shiny and swollen hand,
Chronic pain syndromes develop in what we call a vicious cycle. A vicious cycle is the cycle of pain causing pain, chronic pain that causes secondary complications, which subsequently makes the original chronic pain worse. Chronic pain also affects social roles, such as missing out on children's activities, family functions, and parties with friends. With chronic pain, the patient avoids activities that they once enjoyed, such as exercise and everyday activities. This causes progressive muscle deconditioning. If you don't use it, you truly do lose it. Decreased activity leads to decreased blood flow and aerobic functions needed for healing, which decreases the pain threshold, resulting in further activity avoidance and further deconditioning. In conjunction with the physical cycle of pain is the psychological cycle of pain. Fear and catastrophizing increases pain and intensity and prolongs the duration of pain. Stressors can make pain worse because stress affects the nervous system and makes it more reactive. Anger develops when patients feel like their life is controlled by their pain. All these factors together produce an impoverished mood. Patients also tend to express that they have lost their sense of direction to life. They are stuck. This leads to feelings of depression and worthlessness. This thinking causes increased vulnerability and perception of pain because depression significantly increases the pain threshold.
Could you point to where you're feeling your pain?
Left hand, and also it goes up my arm.
So this is another pain assessment tool, and from a scale of 0 to 10, 10 being the absolute worst pain that you've ever felt in your life and 0 being no pain, how would you describe the pain that you're feeling now?
Maybe a 9. 8 or 9.
A TENS unit sometimes can help to relieve pain. This small battery-operated device is thought to work by blocking nerve impulses.
Mirror visual feedback is designed to trick the patient's brain while directly and eventually transforming their mind. When patients with chronic pain issues anticipate movement to be painful, mirrors help deceive them into thinking that they are not experiencing pain via dynamic feedback to their brains. Using observation of the uninvolved limb helps to drive proprioception in the involved limb, thereby normalizing the movement process. Simply put, the use of the mirror gives the patient the impression of having two normal limbs. The concept behind this visual input modality is that it helps patients re-educate or reintroduce to their altered higher processing neural networks a normal relationship between a physical movement
and the sensory feedback it provides.
Desensitization techniques are implemented to assist with normalizing sensation to the affected area. This consists of progressing stimulation with very soft material to more textured fabrics or materials. Stimulation may be graded from light touch to deep pressure and from consistent to intermittent with each material.
Once the pain is under control, adding resistance to exercises is the next step.
Consists of moving the affected extremity in a back and forth motion while weight bearing through the extremity. The patient scrubs against a hard surface, keeping the brush in constant contact with the surface while maintaining constant pressure on the brush. The amount of weight placed through the affected extremity and the duration of the activity are gradually increased. Scrubbing is performed with the patient in quadruped for upper extremity involvement. Modifications can be made to enhance performance or compliance. For example, upper extremity scrubbing can be done sitting at a table or standing at a counter. Carrying or loading is the second component in the stress loading protocol. Small objects are carried in the hand on the affected side. Progress to a handled bag loaded with increasingly heavier weight. Carrying should be performed throughout the day whenever the patient is standing or walking.
Posture is an important component to consider in treating CRPS. Proper posture and alignment can minimize protective guarding of the extremity, promote balanced use of muscles, and facilitate improved functional use of the affected extremity.
Where can you feel bridging apart?